Okay, so if I talk about today's session is on mediastinum, which is a very important topic. And you have to know about the boundaries of mediastinum, where it is located. You have to know about the divisions of mediastinum and the content and boundaries of each part of mediastinum. That is very, very important for you. Okay, so let me just firstly check. Yeah. Okay, dear. So let's start with this topic. Okay, so everything is visible and the screen is also clear. Okay, so first thing is to know that how we can know the location of mediastinum. So basically, if I talk about the mediastinum, it's a middle part, or you can say medium septum area, which is lying between the two side pleural cavities. Okay, so it is consists of viscera and the structures, which is exactly the part of thoracic cavity which is located, which is consist of great vessels, trachea, esophagus, mediastinal lymph nodes, nerves, vessels, thymus gland, all these structures which is lying between the two sides pleural cavity. You can see on either side there is pleural cavities, as you can see in this diagram. These are the pleural cavities which is residing on either side. The middle area is the mediastinum. Okay, so basically if I talk about it, mediastinum is covered on either side by the mediastinal pleura, and it is actually speaking the central part of the thoracic cavity, which is separated laterally, and on lateral aspect of mediastinum we will have the two sides pleural cavity. So basically, if I just want to know about the mediastinum boundaries and all, you can say posteriorly it will have the all kind of thoracic vertebra, all the 12 thoracic vertebra. Anteriorly it will have the manubrium sterni and the sternal bodies and the sternal xiphoid process. Superiorly there will be superior thoracic aperture. Inferiorly there will be diaphragm, and what will lie on the either side? On either side there will be the mediastinal pleura. Okay, so these are the important points for the mediastinum which you have to know. So mediastinum is a median septum of thoracic cavity which is located between the two sides pleural cavities. So is the median septum. It is a median area, you can say, of thoracic cavity which is actually located between two pleural cavities. And as I told you, the middle area or median area of the thoracic cavity, which is termed as the mediastinum, has got so many structures. It will have the great vessels, it will have arch of aorta, its branches, it will have the brachiocephalic veins, superior vena cava, so many important veins and arteries and the nerves and the thymus gland and the mediastinal lymph node. So basically it will have thoracic duct, esophagus, trachea. So many structures are lying. Heart and the related great vessels covered by the heart, covered by the pericardium. So all these structures will be located in the mediastinum, and it is the central compartment of the mediastinum which is lying exactly between the two sides pleural cavity. So mediastinum, if I talk about the mediastinum, it is covered on either side. It is covered on either side by the mediastinal pleura. So this is the introduction part of the mediastinum which you have to know where it is lying exactly. Now, I would also like to, I have already shown you the image and I have explained you about the mediastinum. Once again, actually, I just want you to understand exactly the boundary of mediastinum. Okay, so let's see this image. I'm slightly enlarging this image so that you can have a clear-cut idea about the boundaries of mediastinum. Okay, so in this case, there is thoracic inlet. So basically there is superiorly the superior thoracic aperture. So I just make a dotted line here. So this is exactly the superior thoracic aperture. So this is actually lying superiorly. So here this will be on the superior aspect. There is the there is the sternum. So this is exactly the sternum, manubrium sterni, sternal body, and the xiphoid process. So basically, this is lying on the anterior aspect. Also, in the inferior aspect, we will have the diaphragm. So inferiorly, there is diaphragm, and posterior aspect, there will be the thoracic vertebrae from T1 to T12. So all these thoracic vertebrae which has been shown here, all these structures are forming the posterior boundary for the mediastinum. What lies on either side? On either side, we will have the mediastinal pleura. So let's define the boundaries. So let's define the boundaries of the mediastinum. Okay, so I would like to write the boundaries. So what is lying on the anterior aspect? So let's define the boundaries. So I have already shown you the important structures in this image, and please tabulate it together. So boundaries of mediastinum anteriorly. So on anterior aspect, it is bounded by sternum. Okay. On the posterior aspect, we will have the thoracic, the part of the vertebral column which is the part of the vertebral column containing bodies of thoracic vertebra and the intervertebral disc. So it contains bodies of thoracic vertebra and the associated intervertebral disc. Okay. What lies on the superior aspect? So when I talk about the superior aspect, we have got the superior thoracic aperture. Actually, we have already discussed about superior thoracic aperture in the introduction class of the thorax region. Inferiorly, we will have the diaphragm. And what lies on each side? So when I talk about the structures residing on each side there is mediastinal pleura. So this is how we can define the mediastinum boundary. So we are knowing what lies on the either side. We are knowing what lies inferiorly, what lies superiorly, posterior, and anteriorly. So this is how we can define the entire boundary of mediastinum. Okay, so actually, if I talk about the middle area of the thoracic cavity, which is termed as the mediastinum, it is having so many important structures. So you have to know all the important structures which is residing inside. So I would like to just tell you about few important structure which is lying inside. To better understand the mediastinum structure, we will divide the mediastinum into various reasons. Okay, so major content of mediastinum. Let's know what are the major contents of mediastinum which is residing in the mediastinum part of the thoracic cavity. We have got following important structures. We have got the thymus gland. We have got the heart. The heart enclosed in the pericardial sac. The heart residing in the pericardial sac. The major arteries and the veins of thoracic cavity or thoracic, so major arteries and veins, major arteries and veins such as thoracic aorta, pulmonary trunks, pulmonary veins. So too many structures. I'm not naming it here all because we will subsequently know the important structures residing in various parts of the mediastinum. We will subsequently know about each every parts. Other than that, it will also have the two tubes, the trachea and the esophagus. It is also having the thoracic duct, the important lymphatic channel. It is also having neuronal structures. Neural structures. What are neural structures which is lying in the mediastinum? The vagus nerve, the sympathetic chain, the phrenic nerve, the recurrent-laryngeal nerve on the left hand side, and we will have the associated lymph nodes. So all these structures are the major content of mediastinum which I have written. These are the major contents of mediastinum which has been tabulated here. Now, other than that, let's know about the division of mediastinum. So it's very important. So basically, division of mediastinum, actually for the sake of understanding the structure location, because mediastinum is a wide area which is having too many structures. Okay, many structures are located inside the mediastinum. So for proper understanding of exact location of the structures residing in the mediastinum, and for the sake or the purpose of description, organization, to understand the location, the mediastinum is subdivided into superior and inferior mediastinum. Further, the inferior mediastinum is divided into three parts: the anterior, posterior, and the middle mediastinum. So this is important for you to understand that how this division is done. So basically, for understanding that, I would like to make a diagram. So a schematic diagram I will make, and I will also tell you about the division of mediastinum in the form of a flow chart. So this will help you to understand the entire boundaries and the parts of mediastinum. So that is very, very important for you to understand. So firstly, you can draw the outline for the mediastinum location, as you are seeing from the, as you are making a schematic diagram to understand its important contents. Okay. So we will, anteriorly, which structures lies? The sternum. So anteriorly, we will have the sternum. This is the sternum, the cut part of the sternum which I have made. Okay. And posteriorly, if I talk about, we will draw the thoracic vertebrae. So posteriorly, I am drawing the thoracic T1. This is T1 and the associated intervertebral disc. So this is T1, T2, T3, T4, T5, T6, T7, T8, 9, 10, 11, 12. Okay, so this is how we have drawn the whole vertebra. So we have drawn these all thoracic vertebrae. So if you want, you can name it inside only. So we have drawn posteriorly all the vertebrae, that is the thoracic vertebrae. Okay, and in the middle we will have the pericardial cavity containing the heart, and below we will have the diaphragm. Okay, so now I am using red color for the heart and the pericardial sac. Okay, the brown color can be used for the diaphragm part. The gray color can be used for the vertebrae and the sternum. Okay. Now, so for the proper understanding, it's important for us to know that, okay, it should be more oblique. If we can make it more oblique, so it will be greater. Okay, so it will be like this. Okay, so we will have this, exactly this is, this can be made slightly enlarged kind of thing. This is just to make you understand. So now we can make a dotted line connecting this. Okay. Okay. Yeah. So now here you can just use like this so that it is more clear to you. So the middle area will be containing the pericardium, containing the heart and the great vessels. You can border it also. Okay. So now we will exactly label it, and then we will, so we can label it. So here we will have, this is exactly, so exactly for understanding, we have to make an imaginary line. So can we use a different color? Yeah. So this is exactly imaginary line which is passing through. This is exactly an imaginary line which is passing here. If you will see this imaginary line, okay. So this imaginary line is passing approximately, if you will see this imaginary line, is passing through posteriorly at the level of T4 to T5 and anteriorly at the level of sternal angle. Sternal angle, or you can say sternal plane. So actually this imaginary line is passing anteriorly from the angle of Lewis, posteriorly in between T4 and T5 thoracic vertebra. So we will have an area which is lying above it. So the area which of the mediastinum which is lying above the imaginary plane, this part is called as the superior mediastinum. This part is called as superior mediastinum. This is superior mediastinum. Okay. Now, anterior to it, we will have this as the anterior mediastinum, and posterior to it, we will have the posterior to the heart and pericardium area and anterior to the thoracic vertebrae. Below the plane, sternal plane, is the posterior mediastinum, and middle. So we will have this, we will have this, and we will have this. So please label it. So this is anterior mediastinum. This is middle mediastinum. Okay. This is the posterior mediastinum. So this is how we have got. So basically, the area above the imaginary plane, which is passing anteriorly through angle of Lewis, that is the junction of manubrium sterni and body of sternum, and posteriorly in between the T4 and T5 thoracic vertebra. This is called as the sternal plane, and this, the part which is like below this plane, is called as inferior mediastinum, which is subsequently. So this is, so basically this part is called as the superior mediastinum, and the inferior mediastinum is again divided into anterior, middle, and the posterior mediastinum. Actually, the heart and the great vessels are called is residing in the middle mediastinum. The anterior mediastinum is a small area which is lying just behind the body of sternum and anterior to the pericardium, and the area of the inferior mediastinum, which is lying posterior to the heart and the pericardium and anterior to thoracic vertebra, is called as posterior mediastinum. So this is how we are dividing the entire mediastinum. What is this structure, my dear students? This structure is the diaphragm, and this line is the superior thoracic aperture. So, okay, we are now knowing how the mediastinum will be divided into following parts. Okay, if anyone is not understanding anything, please let me know. My dear students, if you are not understanding anything, please let me know. Yes, good evening, everyone. Okay, so if you are not able to understand any of this point, please let me know. Actually, this will be more clear if I draw a flow chart for you. So let's come into the division of mediastinum. I want to draw a flow chart. So for example, let's see how the mediastinum is divided into following parts. So mediastinum subdivision. So mediastinum is divided into following parts. Okay, it is divided into, firstly, superior mediastinum and inferior mediastinum. And that of inferior mediastinum. And this division we know that happens via an imaginary plane passing through the sternal plane anteriorly through angle of Lewis and posteriorly in between the thoracic vertebra T4 and T5 intervertebral disc. So yes, this is very easy for you to understand. The mediastinum further divided into superior mediastinum and that of inferior mediastinum. Inferior mediastinum will be further divided into three parts. This is how it is divided into three parts. Okay, so it is divided into anterior mediastinum, which is lying anterior to the heart, pericardium and great vessels. The middle area where we will have the heart, pericardium and its great vessel is the middle mediastinum. And we will also have the posterior mediastinum, which is lying posterior to the heart and the great vessels. Okay, so this is how we are getting the important contents of for the mediastinum. So if you want, you can just make a box it as three subdivisions. Actually, mediastinum is an important question which comes for the MCQs and also has been asked for the enumeration question. Okay, it's also been asked for the enumeration question. Got it? So yes, we can just subdivide it. This is the middle mediastinum. Okay, this is the posterior mediastinum. And we will also have the anterior mediastinum. Now I think it is clear to you how the mediastinum is divided into various parts. Okay, everyone, let me just check with the students. Is it okay? Are you understanding how the entire mediastinum is divided into three parts? Yeah, good evening, dear. Good evening, everyone. So this is how the mediastinum is divided into following parts. Now, the further thing is to know, if I talk about further, I just want you to show this image. This is actually a visualization of the mediastinum as just done in the chest X-ray radiograph. So this is the lateral view of the chest X-ray. So which view is this? This is exactly the lateral view. This is the lateral view of chest x-ray, and in this lateral view of the chest x-ray, so in this lateral view of the chest x-ray, we can visualize following structures. Okay, so this is exactly the lateral view. Okay, yeah, this is the lateral view of the chest x-ray. Then with this, now I just want you to pay attention to this image where you can see, so basically in this image also you can see, let me slightly enlarge this. Yeah, so I've enlarged this chest x-ray. So lower down you can appreciate, yes, this is the demarcation for this is lower down, there is a diaphragm. And what is this posteriorly? We will have all these thoracic vertebrae. So what are these? These are all thoracic vertebrae. P for the posterior. This is the sternum, which will lying anterior, and an imaginary plane which is passing through the T4 and T5 thoracic vertebra and that of sternal angle. Above this, we will have the location of superior mediastinum. So what is exactly this area? This is the superior mediastinum, which is clearly seen in this image. Now, lower to it, we will have the middle mediastinum. The just posterior to the sternum, we have got anterior mediastinum, and the area which is lying posterior to the heart, great vessels, and anterior to that of thoracic vertebra is the posterior media. So this is how the entire mediastinum is divided into following subparts. Okay, this is how it is done. So basically, in the shadows which is shown here, in this case, the shadows which is shown here is demarcated by, so prominent cardiac shadow has been shown in the middle. So prominent cardiac shadow in the middle, which has been shown here, is the middle mediastinum. So this is the middle mediastinum. Okay, you can just write it with as middle. Okay, this is the middle mediastinum. Okay, now just posterior to it and anterior to that of the thoracic vertebra, we have got posterior mediastinum, and just exactly posterior to that of the sternum, we will have the anterior mediastinum. We will have the anterior mediastinum. Okay, so this is how we have divided the entire mediastinum into four parts, and I have given you the flow chart. I have also described it in the lateral view of the X-ray, and I have also described this by making a schematic diagram. Okay, so retrocardiac space, which is lying in between the thoracic vertebrae and the heart anteriorly, is the posterior mediastinum. Anterior to the middle part, that is the cardiac shadow, is the anterior mediastinum, lying just posterior to the body of sternum, and superior to the imaginary plane passing through the sternal angle T4 T5 thoracic vertebra is the superior mediastinum. Done with this. Now after that, let's talk about, so after this discussion, it is quite clear to you about the mediastinums and its subdivision, which I have already explained by the help of a schematic diagram which we have drawn together. Now the first mediastinum which I want to cover, okay my dear students, the first mediastinum which I want everybody to understand is the superior mediastinum. So I would like to firstly tell you about the boundaries of the superior mediastinum. Then actually superior mediastinum is a very important area where we have got various structures. We have got many of the arteries, we have got veins, we have got nerves, we have got lymphatic channels, we have got the muscles, and we have got additional trachea, esophagus, so many structures, and a gland, thymus gland. So all these structures are lying in the superior mediastinum. I would like to enumerate all the structures residing in the superior mediastinum, and then I will give you a diagram for, I will make a transverse section showing the structures residing in the superior mediastinum. Before that, let's firstly know about the boundaries of superior mediastinum. So for understanding the boundaries, I would like to show you the schematic diagram. Okay, so in this schematic diagram, you can see the superior mediastinum. And if I talk about its boundaries anteriorly, so okay, on the anterior aspect, anterior, what lies? Manubrium sterni, the upper part of, so just in charge. What is ANT? So yes, I will just write it more clear. Okay, so anteriorly we have got this part. On anterior aspect we have got the manubrium sterni. Posteriorly, if I talk about, we have got the bodies of four thoracic vertebrae. So T1, T2, T3 and T4 thoracic vertebra, which lies on the posterior aspect. Superiorly we will have this line. This is the line which is corresponding to superior aspect, which is superior thoracic aperture. And in the inferior aspect, again there is an imaginary plane. Let me just draw this imaginary plane. Actually this imaginary plane is passing in between T4 and T5 thoracic vertebra and anteriorly through the sternal angle. So this forms the boundary of the superior mediastinum. What lies on either side? The mediastinal pleura. So let's write the boundaries of the superior mediastinum. Okay. So I think you have understood. And my dear students, let me just check with the message box. If any of the student is not understanding anything, please do ask me. Okay. So write down boundaries of superior mediastinum. So anteriorly, it is bounded by manubrium sterni. My dear student, what is manubrium sterni? Manubrium sterni is the upper expanded part of the sternum. And what lies posterior aspect? So if I talk about the posterior aspect, posteriorly it is bounded by the bodies of upper four thoracic vertebrae. It is bordered by upper four thoracic vertebrae and the associated intervertebral disc. Now, what lies on the inferior aspect? So, inferior aspect. Here on the inferior aspect, we will have an imaginary plane passing through sternal angle and T4, T5 thoracic vertebra. Now, this is inferior. What lies superior? So, superiorly, we will have the superior thoracic aperture. We will have superior thoracic aperture. And what lies on the either side? On either side, we will have the mediastinal pleura. On each side, we will have the mediastinal pleura. Okay, so this is how we are going to define the boundaries of superior mediastinum. And it is also important for you to know the important structures residing in the superior mediastinum. Actually, there is a large number of structures residing in this area. Okay, so firstly, can you see this another diagram? Actually, this diagram is showing you the great vessels, which is the content. So we will have the content. We will have the contents of superior mediastinum as shown in this diagram. We will have. So you can see the yellow color dotted line is the level of sternal angle that is actually dividing the whole mediastinum into upper and lower part, that is superior and inferior part. And this imaginary plane is passing through the sternal angle anteriorly and through the intervertebral disc T4 and T5 posteriorly. So above it, we will have the superior mediastinum. We will have the arch aorta and its great branches and vessels, left subclavian, left common carotid and brachiocephalic trunk. We will have the superior vena cava and the right and the left brachiocephalic vein. Okay, also we will have left superior intercostal vein, which is draining into the left brachiocephalic vein. Okay, so these are the important contents and these are the great vessels. So I want you to know about all the great vessels which is residing in the superior mediastinum. Actually, there are so many important structures. So I just want you to draw a schematic diagram, actually arrangement of structure in superior thoracic aperture. I want you to pay attention to the great vessels. So actually, I am going to make it two diagrams for understanding the contents of the superior mediastinum. So firstly, I will draw a anterior view and I will show you the great vessels, which is the content of superior mediastinum. I will then enumerate all the contents of superior mediastinum. Then subsequently, I will make a transverse section, and in that, from anterior to posterior, I would like to draw a schematic diagram showing all the contents of superior mediastinum. So this is how we will complete the topic of superior mediastinum, and subsequently I will move on with the middle, anterior and posterior mediastinum. So firstly, let's finish the superior mediastinum. So this is showing you. So I just want you to show the superior mediastinum content, the arrangement of structures, and I want you to show the great vessels from anterior to posterior. So basically, superior mediastinum contents have got so many important structures. So I am here making a diagram showing great vessels as the content of superior mediastinum. As you see, the great vessels from anterior to posterior part, from anterior to posterior. Okay, from anterior to posterior. So let's make a diagram for it. So I will just draw a dotted line here, which will be the pericardium. Obviously, above the pericardium, we will have the superior mediastinum. So what I have drawn here is the pericardium. So this is the pericardium. Okay. Now, above it, we will have a few important structures. So let's make the great veins, the superior vena cava and the brachiocephalic veins. Okay. So this is exactly the great veins. Got it? So in the superior left brachiocephalic vein, we will also have the left superior intercostal vein. So and just posterior to the great veins, we will have the arch of Ortagnis branches. So I would like to draw another red color I will use, and I will draw the great vessels. So we will have these branches. Okay. Got it? So you can just clearly draw it because it's important to understand the branches and all. So yes, this is all the branches which I have made. Okay, dear. Got it? I will say it. Don't worry, I will say it. If you want, we can enlarge this so that you can get a clear-cut idea of the important structures which is in the superior. I will write also. So here we are. If you want, you can just write. This is a schematic diagram for superior mediastinum. The great vessels as seen. So basically, this is not showing all the contents of superior mediastinum. I'm drawing the great vessels and few other structures along with the neuronal structures few. So here we will have also we will have the part of trachea and esophagus which will be seen here. So basically there will be also the trachea and esophagus. So this will be the part of esophagus and here will be the part of trachea. Okay, got it, my dear? Okay. And there will be in nerves also. So I will draw the nerves also. We will shade it also. So we can use blue. Okay, we can use this color for the esophagus. We can use orange color for the this is esophagus, orange color for the esophagus and that violet color for the trachea along with the rings. Okay, and I would also like to draw the nerve. So I would also like to draw the recurrent laryngeal nerve and that of vagus nerves. Okay, we can draw the vagus nerve. So I would use I would like to use, so here we can draw the, okay, for nerve. Okay, we can use the right and the left vagus nerve. So this is the right vagus nerve, and here we can draw the left vagus nerve. This will be going down and a looping. I would like to show the looping that is shown with the dotted line and then coming upwards like this. Okay, so we can also, for understanding, we can use a different color here. We can use black color so that you can understand this. This I want to show the looping, my dear. Okay. Yes. This is the nerve, this is the nerve, and this is the looped nerve. Okay. Done. Okay, now let's this is the arteries which I have drawn. This is all the arteries which I have drawn. If you want, you can just outline this. Okay. And we can use blue color for the veins. Why not? We use blue color for the veins. So these are all the vena cavas. Brachiocephalic vein. This is the left brachiocephalic vein. This is the left superior intercostal vein. Okay, got it. And just label it. Okay, so now we can label the important structures which is visualized here. So we will have here, this is the esophagus, this is the trachea, okay, this is the trachea, this is the this is left brachiocephalic vein. And what lies in the left brachiocephalic vein? What is this draining? This is left superior intercostal vein. This is left superior intercostal vein. This is superior vena cava. This is right brachiocephalic vein. This is the right vagus nerve. This is the left vagus nerve. And this loop which I have drawn with a dotted line, this loop which I have drawn with a dotted line, what is this? This is left recurrent laryngeal nerve. So actually, this is how I want you to show the contents of the superior mediastinum, the great vessel. So veins are lying more onto the right hand side, as you can see. Left hand side space is occupied by the arteries, and the veins are lying anteriorly as compared to the arteries. Okay. So actually, it's important to know the contents, and it's also important to know the arrangement of the contents. So done with this superior mediastinum content as seen the great vessels as you proceed from anterior to posterior. Now, my dear students, we can write all the contents. So it's important, and it's important that we should be knowing about all the important contents of superior mediastinum. So I would like to write all the contents of superior mediastinum. That is very, very important. Okay, so superior mediastinum, if I'm talking superior mediastinum is having so many important structures. So it's important that we should be knowing all the important contents of the superior mediastinum. So let's write the structures which is lying in as a content. So I would like to write one by one. So firstly, we will know about all the arteries as the content. Okay, so when I talk about the arteries as being the content of superior mediastinum, okay, so we can just use it clear cut. I am using a different color so that the differentiation is easy. So why not use a red color for the arteries? So all the arteries as the content. So all the arteries, and I would also use blue color for the important veins as the content. Okay, so let's write. So if I talk about arteries, we will have arch of aorta and its branches. So we will have the contents arch of aorta and its branches, important branches. So what are the important contents of, so arch of aorta is the content and its three important branches, which is also the content. What are they? That is brachiocephalic trunk, then we have got left common carotid artery, we will have left subclavian artery. Okay, so these are the important contents of arteries which is residing here. We will have the important contents as the arteries. Then we will talk about the important contents as the vein. Okay, so if I talk about the veins, we will have right and the left brachiocephalic vein, superior vena cava, and left superior intercostal vein. So we will have right and left brachiocephalic vein. Right and left brachiocephalic vein, and we will have the upper half of superior vena cava, upper half of SVC, superior vena cava, and we will have the left superior intercostal vein, which is draining into left brachiocephalic vein. So we will have left superior intercostal vein. So left superior intercostal vein, which drains into the left brachiocephalic vein. So we have got the list of important structures. We have already got the list of important. We have got all the list of veins which is residing in the superior mediastinum. We have also got the list of all the important arteries which is residing in the superior mediastinum. Now I want you to write the list of lymphatics and the other structures. So let's write the other structures as the content of superior mediastinum. So the third important content is the lymphatics. And then we will have the other content. So let's write the lymphatics as the content, and then we will write the tubes. We will have the visceral tubes. Visceral tubes. So what are the lymphatics which is residing here? We will have the thoracic duct as an important content. We will have also the thymus gland as an important content, and we will have other lymph nodes like tracheo, bronchial, pretracheal, paratracheal, brachiocephalic lymph nodes. So we will have tracheobronchial lymph nodes. We will have tracheobronchial, paratracheal, and bronchocephalic lymph nodes. What are the tubes which is residing? So we will have two tubes residing, the trachea and esophagus. We will have the trachea and esophagus residing. Other than that, we will have few nerves and we will have muscles residing there. So we will have nerves. So let's write the list of nerves also. So we will have the important nerves. And then we will have the muscles. Nerves are, so we will have important nerves. We will have right and the left vagus nerve, right and the left phrenic nerve, sympathetic chain, and only left recurrent laryngeal nerve. So we will have right and left vagus nerve. We will have right and left phrenic nerve. We will have right and left sympathetic chain. And we will have left recurrent laryngeal nerve. Okay. Now, we will also have the muscles. So, we will also have the content as the muscles. So, let's know about the muscles. We will have the nerves, which I have already written, and we will have the muscles, which I am writing now. So, what are the important muscles, which is the content? So, we will have actually two muscles attached to the sternum, that is sternohead and sternohead and sternothyroid, and we will have one muscle posteriorly, the longest colli muscle. So, we will have sternohyoid, we will have sternothyroid muscles, and we will have the longest colli muscle. Okay, so we are now with a list of all the structures which is residing. So we have written all the structures which is residing in the superior mediastinum. You can see here that all the structures which are the content, the nerves, the muscles, the tubes, the lymphatics, the veins, the arteries, everything which is an important content has been written. Okay, now other than that, I also want you to know the content of superior mediastinum by making a transverse section. So basically, I will also like everybody to note down. So we are now knowing the important contents. We have made actually one of the image also, in which I have explained you the important contents of the superior mediastinum. As you can see the structures from anterior to posterior, which I have made here. We can see the great vessels in this diagram from anterior to posterior. And then we have also made a enumeration question, that is the content of superior mediastinum. We have listed all the arteries, we have listed all the veins, lymphatics, the tubes, and the nerves and the muscles. Now other than that, I would like to also tell you about the contents. Before that, I just want you to make a transverse section. So let's make a transverse section. So actually it is also important that you should be knowing all the contents from anterior to posterior. So after making a diagram, I would give you the list of structures which you can know about the content as you proceed from anterior to posterior. So now let's make a section, transverse section of superior mediastinum showing the structure. So how we can denote that this structure is lying anteriorly in the transverse section and this structure is lying posteriorly. So we'll make the bony structure sternum anteriorly and we will make the thoracic vertebra posteriorly. So this is how we can proceed. Okay, so I'm making anteriorly the sternum and then I'm making posteriorly the vertebra outline. This is the vertebra. Okay, so this gives us an idea that I am talking about anterior and posterior. This is the vertebra, thoracic vertebra, and this is the sternum. Okay, done. On either side, what lies? The lung and the pleura. So we will have on either side, you can just draw. This is the mediastinal pleuras covering the lung. So I am using this color for the lungs. Okay, this is the lung on either side. Got it? So you can just label it also, my dear. This is the lung. This is the lung of other side, and this is the lining which you are seeing is the mediastinal pleura. Okay, this will be posterior aspect, and how you are knowing it is posterior? Because it is having the thoracic vertebra, and this is the sternum. So it is the anterior aspect. This is manubrium sternum. So manubri sternum, and this is the thoracic vertebra. So now we have got an idea. We have got an idea of anterior, posterior. I think that is clear from this image. We have got an idea of anterior and posterior, which is clear from this image. Okay, this is the posterior and this is the anterior. No doubt about that. Now we have to draw the structures which is lying inside. Okay, so the structures are lying inside. So on the most posterior aspect close to the vertebrae, we will have the sympathetic chain. So we will make the sympathetic chains. And we will have muscles attached here. So we will have the muscles attached. Okay. Okay. So I think this is posterior is already known. So I'm just removing the thoracic vertebra that is already known to you. Okay. Now, yeah, what is this structure? This is right and the left. So I'm using this as the left hand side. So this is left sympathetic chain and this is right sympathetic chain. So what is this? This is left sympathetic chain. This is left sympathetic chain. This is right sympathetic chain. Okay. And these muscles are exactly the longest colli muscle. This muscle is the longest colli muscle. Okay, this is the longest colli muscle. Clear, or you want me to write slightly below? Yeah. Okay. This is longest colli muscle. Yes. Now we will have, actually on anterior side there is sternums and two muscles are attached to the sternum, the sternohyoid and the sternothyroid. So we will have this as the sternothyroid, this is sternohyoid, this as the sternothyroid, and this is as sternohyoid. So again we will use brown color for this muscles. Shade it with the brown color. Okay, so the sternohyoid and sternothyroid muscle. This is sternohyoid muscle and this is sternothyroid muscle. Okay, now we will have the important vessels which is lying in this area of the mediastinum, that is the superior mediastinum, as we proceed from anterior to posterior. So we will have veins firstly. So I will like to make the right and the left brachiocephalic vein. Okay, that is the level, and actually that so we can firstly make the right and the left brachiocephalic veins. Then we will have the arch of aorta and its three branches. So basically three branches of arch of aorta because it's slightly superior. So we will have the branches as you proceed from right to left, brachiocephalic trunk. So it will have the brachiocephalic trunk. Okay. And few of the nerves, and it will also have the trachea. So we will have the tracheal rings. We'll have the tracheal rings. We will have the esophagus. Okay. We will have on the left hand side the thoracic duct. We will have on the left hand side the thoracic duct. Yeah, and in between the nerves. So we will have important nerves. So we will have the right vagus nerve. We will have the left phrenic nerve. We will have also the recurrent laryngeal nerve here. Exactly the recurrent laryngeal nerve. This is the thoracic duct. Recurrent laryngeal nerve will be somewhere here in the tracheoesophageal ring. So you can slightly make the tracheal ring bigger. This is the recurrent laryngeal nerve. So why not label it right itself? This is left recurrent laryngeal nerve. Okay, this is the thoracic duct on the left hand side. So you can make the thoracic duct with green color, no? This is the thoracic duct. You can use orange color for this tube-like structure. This is the esophagus. Okay, this ring will be the tracheal rings. This is the tracheal rings. This is the trachea. Yeah. So we can just make the esophagus here. So this is the esophagus. This is the esophagus lying on posterior aspect. Anterior to esophagus, we have got the trachea. Okay, now coming to the great vessels. So I would like to use red color for that. These are the great vessels. Okay, then we will have the veins. We will have the vena cavas. We will have the great veins. Okay. So this is the left brachiocephalic vein. This is left brachiocephalic vein. Okay. This is left brachiocephalic vein. This is the left subclavian artery. This is the left common carotid artery. Okay, dear. And we have already mentioned the nerves. Actually, we will also have the left phrenic nerve on this side, no, on the left hand side. So we'll make the left phrenic nerve here. So this is the left phrenic nerve. So is it visible, or I would like to use another color? This is the left phrenic nerve. Mm. Just a minute. This is the left common carotid. Okay, just a minute. No, this is the left common carotid artery, and this will be the left phrenic nerve. This is left phrenic nerve. Is it okay? Yeah. And these nerves, these are the nerves. Actually, if you want, you can highlight it more. Yeah. So left hand side, left recurrent laryngeal nerve, left phrenic nerve, I have already shown you. And left vagus. Okay. And we will also have one more nerve on the left hand side. What is that? That is the left vagus nerve. This is the left vagus nerve. Okay, on right hand side we will have right phrenic nerve and we will have right vagus nerve. So this is right phrenic nerve. This is right vagus nerve and this is the right phrenic nerve. So phrenic nerve with a small dot is okay now. This is the phrenic nerve. This is left phrenic nerve. Okay, so all the structures has been labeled. What is remaining is the brachiocephalic trunk and right this is the brachiocephalic trunk BT. Okay, why it has gone? I have, yeah. Why it was rubbed? Okay, this is the brachiocephalic trunk and this is the, okay, so you can just, this is brachiocephalic artery. This is brachiocephalic artery or trunk, brachiocephalic artery, and this is right brachiocephalic vein. This is right brachiocephalic vein, BCV. What is it? Right BCV, brachiocephalic vein. So that is brachiocephalic vein. So actually this is exactly the section which I have made, the transverse section showing the content. So this is exactly the transverse section which has been made showing the content of the mediastinum. All the important structures has been shown in this transverse section. We have also, okay, one more structure is missing, that is the thymus gland. So I will just, like, for here, you can, here itself we will have the thymus gland. So this is exactly the thymus gland which I have made. This is the thymus gland. Okay, what happened? This is exactly the thymus gland. So this is T. And what does T stands for? So here T stands for thymus gland. T stands for thymus gland. T stands for thymus gland. Got it? T stands for the thymus gland. So basically we have labeled all the structures, and I have drawn all the important structures which is residing in the transverse section of superior mediastinum. Actually, superior mediastinum contains many important structures which I have already labeled and drawn. Okay. Now, after that, before proceeding to the next mediastinum, I want, for the purpose of orientation during the surgery, the major structure of mediastinum can be arranged in an order. So I want you to arrange the order of the structures as you proceed from anterior to posterior. So important structures in an order will be, so most anteriorly we will get the thymus gland. Then we will get the veins, large veins. We will also see, after that we will also see the large veins, and we will have the large arteries. We will have then the trachea, and then we will have the esophagus. And most posteriorly we will have the sympathetic trunk or chain. So this is how we will have the arrangement of structures as you proceed from anterior to posterior. Okay. Now let's talk about another clinical aspects related with the superior mediastinum, the potential dead space in superior mediastinum. Now, after drawing the transverse section and also seeing the structures from anterior to posterior, what we can see in the superior mediastinum, the great veins, the superior vena cava, the right and the left brachiocephalic vein, they are more on the right hand side, and the great arteries, left subclavian artery, left common carotid artery, brachiocephalic trunk, so they are more onto the left hand side. So consequently, what happens during increase of blood flow, large veins has got a sufficient dead space to expand on the right hand side as compared to the artery. So this is the dead space of the right side of the superior mediastinum, and because of that the tumors of the mediastinum also protrude into the right hand side. So potential dead space is present in superior mediastinum. The reason is great veins, that is superior vena cava, brachiocephalic veins, are occupying more of the space of right side, and the vessels, arteries, so great arteries, if I talk about great arteries, if I talk about great arteries like left common carotid, left subclavian, and that of brachiocephalic trunk, they are occupying more of left side space. They are occupying left side space. So there is, in case of increased venous return, there is enough space in the potential dead space which is present on the right hand side. So this space is present on right side, and the veins can expand in case of increased venous return. And also in case this dead space can be also the reason for the tumors of mediastinum protruding more onto the right hand side and project in this dead space of superior mediastinum. So yes, we have finished about the whole of the mediastinum, boundaries, content, and we have finished the superior mediastinum. Also, let's now know about the anterior mediastinum. Now, as I have told you, inferior mediastinum is subsequently divided into anterior, middle, and that of posterior mediastinum. So you can see this image which is showing you the anterior mediastinum. So basically, when I am talking about anterior mediastinum, important structures in the so basically you can see this is the anterior mediastinum, and you can see anterior mediastinum. If I talk about, this is exactly a for the anterior, this yellow small color, so this is exactly the space which is lying anterior to the pericardium and the heart, and posterior to the body of sternum. So basically this is exactly the space which is called as the anterior mediastinum space. Anterior mediastinum space is a narrow space, and it is continuous through the superior mediastinum with the spaces of the neck. That is important. So basically anteriorly we will have the body of sternum, as you can see. Posteriorly we will have the thoracic vertebra which is below T4 thoracic vertebrae, and on either side mediastinal pleura will be lying. Superiorly there will be an imaginary plane which is passing, so the sternal angle anteriorly, and T4 and T5 thoracic vertebra. Inferiorly we will have D for the diaphragm. So anterior mediastinal boundaries is defined in the space very nicely, and you can see all the important structures of. So we will one by one know about the anterior mediastinum boundaries. Then I will tell you about the contents of anterior mediastinum also. So we can appreciate the boundaries in this image, as you can see. Now here also you can see in this diagram also you can see this is the area of anterior mediastinum, which is lying just posterior to the sternum body. Okay, this is A for the anterior boundary. Posteriorly, we will have the middle mediastinum, and superiorly, the imaginary plane, which is passing in between T4 and T5 thoracic vertebra, and the sternal angle, inferiorly D for the diaphragm. Got it? On either side, mediastinal pleura. So this is the boundary of anterior mediastinum. Now, anterior mediastinum content we have to see. Actually, one of the important point about anterior mediastinum is that, which you have to know, is that if I talk about the anterior mediastinum, it is also actually it is a very narrow space. So basically, if I talk about anterior mediastinum, boundaries is quite clear in the image. It's a narrow space. It's a narrow space. And if I talk about this narrow space of anterior mediastinum, it is continuous with the superior mediastinum. And because of its continuation of superior mediastinum, it is also continuous with the pretracheal spaces of neck. And actually, if it is continuous with the spaces of the neck, that means infections of the neck can drain into anterior and that of the superior mediastinum. That is very, very important for you to know. Okay, got it? So that is very important. If any of the student is not understanding anything, please let me know. Okay, so this is very important for you to understand. Now, I just want everybody to write down the entire content of anterior mediastinum. That is important. Important contents lying in the anterior. Actually, content of the entire mediastinum different area is important because this come as an enumeration question. So important structures which is lying in the anterior mediastinum is following. It contains loose areolar tissue, the non-specific content only. This is the loose areolar tissues. We will also have superior and inferior sternopericardial ligament. We will have superior and inferior sternopericardial ligament. Actually, the superior and inferior sternopericardial ligament means this ligament is stretching between the sternum anteriorly and pericardium posteriorly. We will also have few of the lymph nodes. So we will have lymph nodes. That is the anterior mediastinal lymph nodes. We will also have the arterial branch, that is internal thoracic artery mediastinal branch. So we will also have mediastinal branch of internal thoracic artery as the content. Internal thoracic artery as the content. We will also have the lower portion of thymus gland. We know that the thymus gland is a content of superior mediastinum, but if I am talking about the lower part of thymus gland, it is again the content of anterior mediastinum. So lower part of thymus gland is also the content of anterior mediastinum. Done? Now, done with this. Now coming to the next one is the middle mediastinum. So now we will talk about the middle mediastinum. So middle mediastinum, if I'm talking about middle mediastinum, is basically containing the heart, the covering, that is the pericardium and its great vessels. So in this diagram also you can understand the middle mediastinum part. Here you can clearly know the middle mediastinum part which has been shown in this image. Okay. So when you see the image, you can understand the middle mediastinum part. This is the great heart covered by the pericardium, pericardial vessels. This is M for the middle mediastinum part. It is exactly lying below the imaginary plane, that is the sternal plane. below is the D for the diaphragm, and anteriorly is the anterior mediastinum, posteriorly is P for posterior mediastinum, this is A for anterior mediastinum. So basically, if I talk about middle mediastinum, we know the inferior mediastinum is divided into A anterior, M middle, and P posterior mediastinum. So middle mediastinum anterior bound. If I talk about anterior structure which lies, so anteriorly it is bounded by anterior mediastinum. Posteriorly it is bounded by posterior mediastinum. Okay. Superiorly it is bounded by superior mediastinum, and inferiorly it is bounded by diaphragm. Inferiorly it is bounded by diaphragm. Okay, got it? Okay. Now, main content of middle mediastinum. If I talk about main content of middle mediastinum, we have got following important contents in the middle mediastinum. We will have the heart as an important content of middle mediastinum. As you can see, we will have the heart as the important content. Then we will have its great vessels. So basically, heart covered by the pericardium. So you can see the dotted line, that is the pericardium. So we will have the heart covered by a pericardium. Pericardial sac. We will have this pericardium. Pericardial sac. We will have the pulmonary veins, the four pulmonary veins. We will have the pulmonary trunk and pulmonary arteries. We will have the lower part of superior vena cava, ascending aorta. So actually, heart with its great vessels, heart with its great vessels are the important contents of middle mediastinum. Other than that, the lymph node associated, the nerve supply of the heart, all these, and the trachea dividing into the principal bronchus, all these are the content of middle mediastinum. So I want you to just write the list of content of middle mediastinum. So let's write the content of middle mediastinum. The content of middle mediastinum is following. It contains the heart, the pericardium, the arteries. Which are the arteries which forms the content of middle mediastinum? Okay, so if I talk about the arteries which is forming the content of middle mediastinum, it will have the ascending aorta. So ascending aorta, which is emerging from which chamber of the heart? Left ventricle. And also we will have pulmonary trunk from the right ventricle. So we will have the pulmonary trunk, which will divide into pulmonary arteries, which divides into pulmonary arteries. Also we will have pericardiophrenik arteries as the content. We will have pericardiophrenik arteries as the content. Then, so we have written the heart, the pericardium, the great arteries, and I also want you to write the veins, which is the content of middle mediastinum. So let's write the veins. The important veins which is forming the content are, so we will have following veins as the content. The important veins are the superior vena cava lower part, superior vena cava lower part, a gyrus vein terminal part, a gyrus vein terminal part which drains into superior vena cava, and the pulmonary vein. So basically we will have right and the left two pulmonary veins. So together we will have four pulmonary veins. So pulmonary veins, right and left side both. So these are the important contents, that is the heart, pericardium, the great vessels, and other than that we will also have the other contents like nerves. important nerves which is forming the content of middle mediastinum is following. So it will have important nerves like deep cardiac plexus and the phrenic nerve. So it will have the phrenic nerve as the content and deep cardiac plexus. Other than that, we will also have lymph nodes, that is tracheobronchial lymph nodes. So we will have tracheobronchial lymph nodes. We will have the important tubes, that is the bifurcation of trachea into right and left principal bronchus. So we will have the right and the right and left principal bronchus and also the tracheal bifurcation. So we will have two tubes, that is bifurcation of trachea will be as a content, and we will have right and left principal bronchus. We will have right and left principal bronchus. The main contents of the middle mediastinum are actually the pericardium and the heart and its great vessel. That is the major content of middle mediastinum. Okay, so we are now done with the details of the superior mediastinum, the middle mediastinum, the anterior mediastinum, and the overall boundaries of mediastinum. We have also made a systemic diagram showing the great vessels residing in the superior mediastinum. We have drawn a transverse section showing the contents of superior mediastinum from anterior to posterior. Now the other land, the last mediastinum which I want you to explain is the posterior mediastinum. Posterior mediastinum is actually lying posterior to the middle mediastinum. So again, you can see this is a diagram where I just want you to explain here. This is an imaginary plane. Again, this imaginary plane is passing anteriorly to the sternal angle as shown in this diagram. Posteriorly between T4 to T5 thoracic vertebrae. This is S for superior mediastinum. We have already completed it. We have M for the middle mediastinum. We have got A for the anterior mediastinum. And this is P for the posterior mediastinum, which we have to study. The posterior mediastinum is lying anterior to the thoracic vertebra from T5, T6, T7, T8, T9, T10, and 12. Inferiorly, again, it will have D for the diaphragm. Anteriorly, it will have the middle mediastinum. So basically, firstly, I would like everybody to know the content, know the boundaries of posterior mediastinum, and then know the content. I will also draw a schematic diagram showing the content of posterior mediastinum. Okay, and then we will study about the clinical anatomy. So done. So let's, okay, before content, it is important to know the posterior mediastinum boundaries. So let's discuss posterior mediastinum boundaries. So this will be, this is already done, T4 to T5. Now in the boundaries, please write down the boundaries of posterior mediastinum, what lies anteriorly. So which structure is forming the anterior boundary of posterior mediastinum? The structure forming the boundary for posterior mediastinum. Anteriorly, we will have the pericardium and its content. Actually, not only pericardium and its content. So basically, not only pericardium and its content, it will also have not only pericardium and its content, it will also have the tracheal bifurcation and pulmonary vessels. So it will have bifurcation of trachea and vessels, pulmonary vessels. So all these structures of the middle mediastinum will be lying anterior to the posterior mediastinum. Done. So it is the pericardium and its content, pericardium and its content. Okay. Done. So these are the structures lying in the anterior aspect. Now coming to the structures which is lying on the posterior aspect. So posteriorly, as we have seen in this image also, we will have the bodies of lower 8 thoracic vertebra. And their intervertebral disc. We will have intervertebral disc, associated intervertebral disc. Okay. So this is the boundary, anterior, posterior. Other than that, we will have what structure is lying superior. So superiorly lies the imaginary plane. Superiorly lies the imaginary sternal plane, you can say. Imaginary sternal plane. Till now, so many times I have explained you the location of this imaginary sternal plane. So I think you are knowing it. No need to write once again. So we have written about the boundaries, anterior boundary, the posterior boundary, the superior, and now we have to know what lies on the inferior on each side. Inferiorly lies the diaphragm, and on each side we will have the mediastinal pleura. Inferiorly we have got the diaphragm, and on each side we will have the mediastinal pleura. Mediastinal pleura. So this is how you can define the posterior mediastinum boundaries. Okay, this is how you can understand the posterior mediastinum boundaries. Okay, so now we are knowing the posterior mediastinum boundaries. Next is to know the content. So let's talk about posterior mediastinum content. So let's talk about important contents of posterior mediastinum. Important contents of posterior mediastinum are: it contains esophagus. So basically, it is important for you to know that trachea is not the content of posterior mediastinum. Actually, trachea and tracheal bifurcation is lying anteriorly in the posterior mediastinum. Okay, then it will have the thoracic duct as a major content. Thoracic duct, important content. It will also have descending thoracic aorta and its branches. It will have the contents, that is descending thoracic aorta and its branches. It will also have a azygous vein, hemiazygous vein, and accessory hemiazygous vein. So it will have all these azygous system of vein. Azygous vein as the content, accessory hemiazygous and hemiazygous vein as the content. It will also have the vagus nerves as the content, both vagus nerves. It will have the sympathetic trunk and the splanchnic nerve as the content, and the posterior mediastinal lymph node. It will have sympathetic trunks and splanchnic nerves as the content, and it will have the posterior mediastinal lymph node. Posterior mediastinal lymph nodes. So all these are the contents of posterior mediastinum. Now we can draw a schematic diagram about the posterior mediastinum content. So basically I will draw a schematic diagram as from anterior to posterior, the content of posterior media, important contents, which I will mark also. Important contents I will mark also. Okay. So basically what is the anterior boundary for posterior mediastinum? Anteriorly we will have the tracheal bifurcation. Just to I will draw a tracheal bifurcation on the anterior aspect. Okay. This is the trachea. Okay. Okay, and then the content, just posterior to trachea, we have got the esophagus, the tube-like structure. So we will have the esophagus tube as the content. Okay. We will have the descending thoracic aorta, and here I will draw a beaded structure. What is that? That will be the thoracic duct. I will also draw the descending thoracic aorta. Okay, this is the descending thoracic aorta. Okay, we can just use gray color for the trachea. This is the trachea and tracheal bifurcation. Okay, and we can use red color for the this structure. What is this? This is the descending thoracic aorta. We will have green color for the beaded thoracic duct. Okay, we will have also the astragalus vein. So I am using orange color for this esophagus. This is the esophagus. We will have the astragalus vein. We will have the astragalus vein here. Hmm. Any doubt you can ask me. Okay, this will be with dotted line. Please try to make a neat label diagram. Okay, it should be anatomically correct. It should not be very beautiful, my dear, but it should be anatomically correct. That is my important point which you have to note down. Okay, other than that, okay, nerves also we can show here. We can show the vagus nerves. Okay, we can have the vagus nerve here. That is the nerve content. So you can just draw this nerve. Okay, so label it. This is the vagus nerve. This is the left recurrent laryngeal nerve, which is winding. This is the thoracic duct. This is the esophagus, this is the trachea. This is the this is the arch of azagus vein. This is the arch of azagus vein. This is the right principal bronchus and the left principal bronchus. This is descending thoracic aorta. This is descending thoracic aorta in important content. This is the left principal bronchus. This is right principal. This is azagus vein. This is thoracic duct. And this is the azagus vein. What happened? This is thoracic duct, an important content, and this is the azagus vein. This is left principal bronchus. So yes, important contents which are seen here: descending thoracic aorta, the vagus nerve, the thoracic duct, the esophagus, the azagus veins, all these. So basically all these important contents has been highlighted. And so also the tracheobronchial lymph nodes. Okay, I didn't make the lymph nodes, so why not I will make now the tracheobronchial lymph nodes. So we will have here few of the lymph nodes. So this is tracheobronchial lymph nodes. So this is the content. So we will have tracheobronchial lymph nodes. So important contents has been highlighted, and this is giving you the look which is seen as the content from anterior to posterior. Important content is the thoracic duct, which you can appreciate, vagus nerve, which you can appreciate, descending thoracic aorta, its branches, you can appreciate the esophagus, you can appreciate the azagus vein. And also the lymph nodes which will associated more posteriorly will be the content. Posterior mediastinal lymph node will be the content. Associated lymph nodes is the posterior mediastinal lymph nodes. Okay. So this is the showing you few important contents as you see from the anterior view of the posterior mediastinum. So we have finished all the important contents. We have seen all the mediastinum we have finished. But what is important for you is to know the clinical anatomy related to the mediastinum. So let's start the clinical anatomy. So one of the clinical anatomical case is the inflammation of the loose areolar tissues in the mediastinum, causing the condition of mediastinitis. Itis means inflammation. So here in this condition there is inflammation of loose connective tissues of mediastinum. Okay, tissues of mediastinum. Now, basically, the fascicle spaces of the neck, that is, if I talk about the fascicle spaces of the neck, that is basically the pretracheal and retropharyngeal spaces, they will descend below the infections, and the mediastinum can be getting infected from the deep infections of the cervical or neck region. So basically, the infection of the neck region, which is residing, can track down in the mediastinum and can cause inflammation of loose connective tissues in the mediastinum. This is leading to the condition of mediastinitis. Okay, inflammation, connection. So basically, this infection can track down into the media. The infections can track down in the region of mediastinum and causing the infection. So therefore, deep infections of the neck, deep infections of neck region, basically in the pretracheal and retropharyngeal spaces, in the pretracheal and retropharyngeal spaces, these spaces can communicate actually and can cause the case of mediastinitis. Okay. Now, Now let's see the another case. This is subcutaneous emphysema at the root of neck. So here what happens, if I talk about the case of subcutaneous emphysema at the root of neck, we know that in the neck region, actually the structure which is deeply embedded in the mediastinum, and we know that if there is any kind of injuries, so basically the continuation of mediastinum and the neck region spaces, the spaces in the neck region is the region of subcutaneous emphysema at the root of the neck. So basically if there is a case of esophageal perforation which is caused by penetrating injuries which can escape, and so this injuries will involve infections, air spaces, and which will continue down in the connective tissue spaces of mediastinum and may ascend beneath the fascias of the root of the neck, and this will cause a case of subcutaneous emphysema. So basically we know that mediastinum is having loose areolar tissue that is continuing with the loose connective tissue of the root of the neck. So mediastinum, the reason is mediastinum connective tissues. So this is the involvement of root of neck, and you can see it is tracking down in the mediastinum region. So basically what happens, mediastinum connective tissues can communicate with the connective tissues of root of neck. So basically in case of esophageal perforations, so this can be due to penetrating wound. So this esophageal perforation can be due to penetrating wound, and this penetrating wound will cause air space to be involved in the air spaces to be involved into the connective tissue spaces of mediastinum. So basically air spaces of the root of neck can be involved, and it will involve the air spaces region, air spaces and loose connective tissue spaces of the mediastinum. Okay, and basically if I talk about these infections, these can be actually present in below the fascia in the form of subcutaneous. So below the fascia, so below the deep cervical fascia, they will present as emphysema at the root of neck. So basically this is the case. So basically we know that the structures that make up the mediastinum is the loose connective tissue embedded, and this is continuous with the loose connective tissue of the root of neck that forms the anatomical basis for the emphysema formation at the root of neck. Mediastinal syndrome. So mediastinal syndrome, when I talk about the condition of mediastinal syndrome, actually the compression of mediastinum by a growth of structures like tumors, cyst will give rise to a group of clinical scenarios, and these clinical scenarios are called as mediastinal syndrome. So the common cause of mediastinal syndrome is, so the common cause of mediastinal syndrome will be bronchogenic carcinoma, will be due to aneurysm of aorta, enlargement of mediastinal lymph nodes. So basically, if I talk about enlargement of mediastinal lymph nodes, this can be seen in the case of lymphomas. Most common Hodgkin lymphomas, as seen in the case of Hodgkin disease. So basically in all these conditions, there can be the mediastinum involvement and there can be compression of structures in the mediastinum. So the compression of structures in the mediastinum will lead to the mediastinum syndromes. They can lead to mediastinal syndrome. So for example, if there is a compression of superior vena cava, so that will cause engorgement of veins in the upper part of the body. So basically, if I talk about the clinical scenario in this condition, the clinical features. So basically, if there is a case of bronchogenic carcinoma, there is a tumor, there is Hodgkin lymphoma, enlargement of lymphatics, there is also aneurysm condition which is involved in mediastinum. The clinical basis will be due to the involvement of structures. So there can be engorgement of, so due to obstruction of, so due to obstruction of superior vena cava, as we know, due to enlargement of lymph nodes or carcinomas, this can cause engorgement of veins. mainly in upper half of the body and neck region. Also, the patient can have difficulty in breathing due to compression of trachea. Patient will have difficulty in breathing. That is the condition of dyspnea. And the patient will have dyspnea due to compression of trachea. Actually, we have already discussed many important structures are lying in the mediastinum. So any kind of enlargement or space is hampered in the mediastinum space. It is lessened due to enlargement of tumors, bronchogenic carcinoma, any kind of aneurysm is involved. So this can lead to the obstruction of many important structures or compression. So we will also have so compression of trachea will cause dyspnea. Compression of esophagus will cause dysphagia. Okay, compression of esophagus. Also, the patient can have compression of actually recurrent laryngeal nerve can be also involved, and there will be so left recurrent laryngeal nerve can be compressed. As we know, left recurrent laryngeal nerve is the content, and this can also cause difficulty in breathing, that is dyspnea. Also, there can be in large case of or a long lasting case of enlargement and disruption of structures lying in the mediastinum, there can be case of erosion of bodies of thoracic vertebrae. So then these are the important features which will be seen, and in the case of mediastinum syndrome. Okay. Now talking about the next clinical condition, widening of mediastinum. So widening of mediastinum, actually what happens, if I am talking about widening of mediastinum, actually this is observed when the chest X-ray has been done, and it can be due to any kind of hemorrhage in the mediastinum, which can be from the great vessels which is residing in the media. So already I have told you great vessels, the superior vena cava, the aorta, all these structures, and if there is an wound, there is lacerated wound or trauma of these great vessels in the mediastinum, it can lead to widening of mediastinum. Massive enlargement of mediastinal lymph nodes can also cause widening of mediastinum. Can you see this image here? You can see the mediastinum has got is widened in this condition. It is widened. Okay, it is widened. So this is an important. So let's see when it is seen. So when I'm talking about widening of mediastinum, it can be seen in the conditions. So it can be seen a number of reasons are there, where there can be a number of reasons. Few of it you should know. One is the hemorrhage. Due to hemorrhage in the mediastinum, that is, if I'm talking about mediastinum hemorrhage which is seen, this is due to lacerated wounds of laceration of great vessels. Lacerations of great vessels like superior vena cava and aorta, and there will be bleeding, and following to this injury, there can be widening of mediastinum. The other important reason is massive enlargement of mediastinum lymph nodes. Massive enlargement of mediastinal lymph nodes. Okay. Also, there can be a case, the widening of mediastinum can be also seen in case of hypertrophy of the heart. In the clinical scenario, when there is congenital heart failure, so there is a case of CHF, that is congenital heart failures. In that case, also there is widening of mediastinum. So these are few of the condition where we can observe the widening of mediastinum. So you can see here in this image, the mediastinum is widened. Okay, the mediastinum is widened because of various reasons. Enlargement of the huge enlargement of mediastinal lymph nodes, bleeding in the mediastinum following head-on collision or any kind of injury to the great vessels, heart failure, congestive heart failure, and enlargement of the chambers of the heart. Now coming to the next clinical scenario, mediastinal shift. So let's talk about mediastinal shift. So mediastinal shift, when I'm talking about the condition of mediastinal shift, okay. So basically mediastinal shift is seen as a common condition which is due to the involvement of lung and pleural pathologies. So this is due to common in case of pleural and lung pathology. Okay, so basically the mediastinum is affected. So basically the mediastinum shift to the there is a appreciable reduced spaces. Okay, so if I am talking about the affected side, the mediastinal shift to the disease side due to intrapleural pressures increase as the lung volume decrease in the intrapleural pressure collapse. Actually, mediastinal can indicate that there is involvement of lung pathology. So basically, the mediastinal shift can be detected by palpating the trachea and the suprasternal nose. So can you see here? This is the trachea. So can you see the trachea is shifted? In this condition also, if so basically what happens, this is the diseased lung, you can say diseased means diseased lung pathology. So lung pathology is there, involvement on one side, and you can see the whole mediastinum and also the trachea. You can see it is shifting towards the side. We can palpate it via the suprasternal notch and trachea palpation. So basically that is the reason. So mediastinum shift to the healthy side when the intrapleural pressures is affected in the disease side. So basically the mediastinum shift to healthy side and this condition can be detected by palpating trachea and suprasternal notch. Trachea in the suprasternal notch. So this can be done by palpating the trachea in the level of suprasternal notch, and basically that shift happens to the healthy side because disease side the space is less and actually high pressure intrapleural pressure is increased. So that shifting of mediastinum happens. Now, actually, I would also like to tell that extension of pus can happen into the posterior mediastinum from the neck. So, from the neck condition, we know that the neck, if I'm talking about the cervical neck collar, the cervical deep cervical fascia and the spaces. So, we will have the retropharyngeal spaces in the neck region. We will have prevertebral layer of the deep cervical fascia, pretracheal layer, and adjoining deep neck region will have certain spaces. So that spaces are involved and infection is there that can track into the mediastinum. As you can see, the neck is involved and also the mediastinum. Mediastinum is involved in this case. What is the reason? So posterior mediastinum is continuous through the superior mediastinum. It is continuous with the superior mediastinum in the neck between the prevertebral and pretracheal layer of deep cervical fascia. So basically the pus, if I am talking about the pus can drain from neck can extend into the posterior mediastinum as shown in this condition. So basically we know that there is pretracheal layer, prevertebral layer of deep cervical fascia, and the spaces in the neck we have got retropharyngeal spaces, spaces related to prevertebral and pretracheal region. The infection in the neck spaces can track down because of the continuity of the neck spaces with that of the superior and that of posterior mediastinum. So this is how the infection can extend into the posterior mediastinum, which has been shown to you. Okay, now here actually this is also sometimes seen, not always, that is extension of pus can also happen from the mediastinum to the thigh. So extension can also be seen from posterior mediastinum to the thigh region. Actually this happens, we know there is a Schwarz sheath, and actually this Schwarz sheath communicates with the posterior mediastinum. by a funnel shaped orifice. Actually, the pus, so basically, this communication happens via Schwarz. We know that the this communication is why it is happening actually in the neck and in the vertebrae. We know that lower thoracic vertebrae. So basically, the Schwarz sheath communicates with the posterior mediastinum by a funnel shaped orifice. The pus from posterior mediastinum can easily track into the Schwarz sheath. So basically, if there is any kind of involvement of posterior media, long lasting cases there, and we know that lower thoracic vertebrae are there, and then the lumbar vertebrae, that tracking can happen into the Schwarz sheath. And we know that Schwarz sheath tracks from the femoral triangle, and we know that they also extend lower down to the lesser trochanter. We know that the iliopsoas muscle together goes to the lesser trochanter of femur. So that means in extreme condition, posterior mediastinum infection, which is received from the upper region of the deep cervical fascia spaces of the neck, and then can they track via Schwarz sheath and can also enter into the lower limb. So this is another format where the infection can track. So basically, it's very important that you should understand all the important points about the mediastinum. So before ending the session, I would like to check with the students anything which they have not understood and anything they want me to explain once again. Is it okay? Have you understood, my dear students? Okay. If anything you are not understanding, please let me know. So before ending the session, I'm going to end the session. Before that, I would like to just give you a quick recapitulation of all of the things which I have completed in this session. Firstly, I have told you the location of mediastinum is the middle area, median area of the thoracic cavity. On either side, there is mediastinal pleura. Superiorly, there is superior thoracic aperture. Inferiorly, there is diaphragm. The mediastinum for the location of important structure is again divided into superior and inferior mediastinum by a imaginary plane which is passing anteriorly from the sternal angle posteriorly in between T4 and T5 thoracic vertebrae. The inferior mediastinum is subsequently divided into three parts. Actually, in the middle area, we have got the heart covered by pericardium, having pericardial sac and its great vessels. So anterior to this pericardium and posterior to the body of sternum, we have got anterior mediastinum, which is a narrow space containing sternopericardial ligament, mediastinal branch of internal thoracic artery, few lymph nodes, and the lower part of thymus gland. The posterior mediastinum, which is lying posterior to the middle mediastinum and anterior to the lower 8 thoracic vertebrae, it is containing the thoracic duct. It is containing descending thoracic aorta and its branches, the vagus nerve, the sympathetic chain, the splanchnic nerves, and azygous veins. All these structures are contained in the posterior mediastinum. Already, when I was discussing about the superior mediastinum, I told you many important structures are residing in the superior mediastinum. The arteries, the arch of aorta and its branches, left common carotid, left subclavian, and brachiocephalic. The veins, superior vena cava, upper part. Please note down, upper part of superior vena cava is the content of superior mediastinum. Lower part of superior vena cava is the content of the middle mediastinum. Same way, thymus gland, upper part, and more of it is a content in superior mediastinum. Lower part of thymus gland is the content of anterior mediastinum. Also, the nerves, which is the content of superior mediastinum, is right and the left vagus nerve, the sympathetic trunk of right and left side, the phrenic nerves of right and left side, and only the left recurrent laryngeal nerve, which is looping around the arch of aorta. We have got the veins, which is in the superior mediastinum, superior vena cava, right and the left brachiocephalic vein, and the left superior intercostal vein, which is draining into left brachiocephalic vein. The muscles, that is sternohyoid, sternothyroid, and longus colli muscle, the trachea, esophagus, and the thoracic duct, and associated lymph nodes. So all these structures are the content of superior mediastinum. We have also made a diagram. In that diagram, I have made a transverse section diagram. Anterior and posteriorly, we have drawn the sternum and the vertebrae, and we have located all the important contents of that superior mediastinum. So it is very important that you should also make that diagram. I have made a schematic diagram to explain you how the mediastinum is divided into superior, inferior mediastinum, and how further inferior mediastinum is divided into middle, anterior, and posterior mediastinum. We have also discussed the clinical anatomy, like how the infection from the neck region spaces is tracking into posterior mediastinum, how it is involving the superior mediastinum, which condition causes widening of mediastinum, what are mediastinal syndromes, and mediastinitis, all has been discussed. So it's very important that you should go through this all important topics. Why? Because mediastinum is a very important topic for enumeration question being asked. Also, image based question can be asked. You have to draw a diagram showing the content of superior mediastinum, and also you have to know about important contents of each and every mediastinum, which can ask as a MCQ also. All the best and keep studying. We'll meet in the next session. Thank you so much.